One of the key elements of gait for a clinical assessment is speed. Slower speeds are really not very functional, and faster speeds improve function. And so knowing which kinematics are connected to speed is relevant to us. So we can see in these graphs, we have ankle graphs here in the lower right, knee graphs in the middle, and hip graphs on top. Each graph is plotted from heel strike to the subsequent heel strike on the same side. And there's several lines showing the patterns of each joint across a gait cycle that are all done at different speeds. The arrows point to significant changes in angles for that particular angle, for that particular joint, with the arrow pointed in the direction of the changes that's attributed to increased speed. So let's start at the hip joint. We can see that essentially the initial contact phase is the only point that's significantly associated with an increase in speed across the hip, a gait cycle. And so essentially the most significant change related to increased speed is as the person gets faster, we can see the lines go to more and more hip flexion position at initial contact. So greater hip flexion is associated with increased speed. And if you think about it, greater hip flexion would increase stride length, which is would make the person go faster per stride. They'd cover more distance per stride. So if we look at the knee, we can see is that there's 2 points that are significantly associated with speed. One is increased knee flexion at the end of weight acceptance, okay, or the transition from weight acceptance to mid stance, and we can see that it's happening here. There's increasing knee flexion with increasing speed. So essentially the shock absorption associated with knee flexion increases as the person takes bigger strides. There's also slightly more knee extension, so the knee hyperextends a little bit more at the transition from mid stance to terminal stance. Now, what may be surprising is the ankle. So we can see here is that this is the normal ankle curve, where we see dorsiflexion peaking right at the transition from terminal stance to pre-swing, when we have this rapid plantar flexion occurring. But what we can see is that kind of counterintuitively, as we increase speed, what happens is dorsiflexion decreases. So this means that essentially what's happening is we increase speed, our heel comes off a little bit earlier, so that we don't get quite as much dorsiflexion as in terminal stance. Now, and you can see that this arrow here indicates that what's happening is plantar flexion starts earlier. So normally plantar flexion would start up here, which is at that exact point of transitioning into terminal stance. And now as we go faster, what's happening is the plantar flexion is occurring earlier, so we don't go into as much dorsiflexion. Now, the other thing that happens is we go into a slightly more plantar flexion right during that pre-swing phase, peaking at the transition from pre-swing to initial swing. So that's a summary of the changes in ankle, knee, and hip joint angles due to increasing speed.